If you're over 60 and still masturbating the same way you did in your 30s, you could be causing serious damage to your circulation, prostate, and nerve function. As a urologist with 25 years of experience, I've seen the consequences of men who never adapt their technique to their aging body. Today, I'll explain how to masturbate safely after 60, the 3 critical mistakes, and warning signs for medical help. I'm Dr. May Anderson, a board-certified urologist. I've treated thousands of men dealing with complications from not understanding how masturbation needs to change as we age. This isn't a topic most doctors discuss, but it should be, as masturbation after 60 can either support or seriously damage your health. The difference comes down to technique, frequency, and knowing when something's wrong. Let's start with the medical facts. Masturbation isn't unhealthy after 60. Regular, gentle self-stimulation supports prostate health, maintains circulation, and preserves sexual function. But your approach must change because your body has changed. After 60, critical systems affecting sexual response undergo significant shifts. Your testosterone levels decline by 1 to 2% per year after age 30, accelerating after 60. Blood vessels supplying your penis become less elastic, making erections slower to develop and harder to maintain. Your nerve endings become less sensitive, a process neurologists call age-related sensory decline. Nerve signals take longer to travel. Most importantly, your recovery time increases dramatically. The refractory period can extend from minutes in your 20s to days in your 60s. When you don't adapt your masturbation technique to these changes, you can cause lasting damage affecting both solo and partnered sexual experiences. I'll walk you through the 3 most dangerous mistakes men over 60 make, leading to nerve damage, prostate inflammation, and circulation problems. Then I'll give you my step-by-step protocol for safe masturbation after 60, including positioning and product recommendations. Finally, I'll cover warning signs requiring immediate medical attention and how to discuss them with your doctor. This information can prevent irreversible conditions. The first and most damaging mistake is using excessive pressure and grip strength. When sensitivity decreases, the instinct is to grip harder. This is the wrong approach and can cause permanent damage. The penis contains delicate erectile tissue called the corpus cavernosum. These spongy chambers fill with blood during arousal and are surrounded by sensitive nerve pathways and tiny blood vessels. Excessive pressure compresses these structures, causing lasting damage. Over time, this can lead to pressure-induced neuropathy or nerve damage. I've treated men with permanent numbness from consistently using too much pressure during masturbation over years. Excessive grip can also damage small blood vessels, leading to reduced circulation and difficulty achieving erections. This creates a vicious cycle. Decreased sensitivity leads to more pressure, causing more damage and even less sensitivity. Patients tell me they need an extremely tight grip to orgasm, which would be painful with a partner. This indicates nerve damage from years of excessive pressure. The medical solution is pressure titration. Start with the lightest touch that produces sensation. Allow 60 to 90 seconds for nerve pathways to activate before gradually increasing pressure. Never grip so tightly that you compress the shaft completely. Think of it as gentle massage, not mechanical manipulation. If this is helpful, subscribe to Vital Health Seniors. My next video will reveal the 3 biggest erection killers unrelated to testosterone. Now, let's discuss the second critical mistake, masturbating too frequently for your age-related recovery capacity. Your prostate produces about 30% of your seminal fluid. After 60, it needs significantly more time to replenish these secretions. Too frequent masturbation forces your prostate to overwork, leading to inflammation, discomfort, and potentially contributing to benign prostate enlargement. Additionally, hormone cycles change dramatically after 60. Frequent ejaculation can disrupt testosterone rhythms, causing fatigue, mood changes, and decreased libido. From my clinical experience, the optimal frequency for most men over 60 is every 48 to 72 hours. This allows for prostate recovery, hormone normalization, and nervous system reset. Quality over quantity becomes increasingly important as we age. The third mistake is attempting masturbation without proper lubrication. Many men think it's only for vaginal intercourse, but this is medically incorrect after 60. As testosterone declines, your body produces less natural lubrication. Pre-ejaculatory fluid may become scanty or disappear entirely. Simultaneously, penile skin becomes thinner and more susceptible to microtrauma. Dry masturbation creates friction, causing microscopic tears. These microtears allow bacteria to enter, potentially leading to infections, inflammation, or conditions like balanitis. From a urological standpoint, the solution is straightforward. Always use a high-quality, unscented, water-based lubricant before any self-stimulation. Avoid products with glycols, parabens, or artificial fragrances, as these can irritate sensitive aging skin. I recommend brands like Good Clean Love, Aloe Cadabra, or drugstore options like KY Naturals. Now, let me give you my complete protocol for safe masturbation after 60, what I call the CARE method, with specific positioning and technique recommendations. C stands for cleanliness and comfort. Always wash your hands thoroughly and ensure your environment is clean, private, and comfortable. A stands for appropriate technique. Apply lubricant first, which is non-negotiable after 60. Start with light pressure and slow movements. R stands for respect timing and recovery. Allow 15 to 20 minutes for the experience. Follow the 48 to 72 hour recovery rule between sessions. E stands for evaluate constantly. Pay attention to your body's signals during and after masturbation. Any unusual pain, changes in sensation, or unexpected responses deserve medical attention. Speaking of medical attention, here are the specific warning signs that require immediate evaluation by a urologist. First, any pain during or after masturbation lasting over 30 minutes. Second, sudden changes in sensation, new numbness, burning, or tingling. Third, visible changes like swelling, discoloration, unusual bumps, or any discharge. Fourth, urinary symptoms like difficulty starting or stopping urination, changes in flow or pain. Fifth, any bleeding. And sixth, persistent changes in erectile function. Don't hesitate to contact a urologist about these concerns. Early intervention prevents minor issues from becoming major problems. Masturbation after 60 can be a healthy part of your self-care routine when done correctly. It supports prostate health, maintains circulation, reduces stress, and helps preserve sexual function. But it requires adapting your technique to match your body's changing needs. Remember the key principles: slower, gentler, less frequent, and always with proper lubrication. Your body has earned your respect and care. This isn't about performance, it's about maintaining your health and staying connected to your body positively. If this guidance was helpful, subscribe to Vital Health Seniors for more evidence-based men's health information. Don't suffer in silence if you have concerning symptoms. Your sexual health is an important part of your overall health. Addressing issues early prevents more serious problems later. Take care of yourself. You deserve to age with confidence, comfort, and dignity.